Welcome to the Boone County Hospital Foundation's Educating and Empowering You program. We are providing a monthly topic that is related to health and wellness and helping create an opportunity for our patients and our community to learn more about our patient portal today. My name is Sarah Clute-Bain. I am the Foundation Director here at Boone County Hospital. But today we're going to have Kelli Flynn, who is our clinical analyst here at Boone County Hospital in our information technology department, sharing all the intricacies of the patient portal. So without further ado, I will turn it over to you, Kelli.
Thank you, Sarah. Thank you for the invite. I was really excited to show our community and patients around the patient portal. We have lots of functionality within that I will show you. I'm going to show you how you can register, what we need on file. This is an access 24/7 for yourself. We also have an app that you can download. As of 2025, we will be doing a system upgrade, and we will get a lot more functionality within the patient portal that I'll be excited to share with you next year. But for now, we do have a lot that we would like to increase our numbers. So we thought this was the perfect way to show our patients how to use the patient portal. So welcome and thank you. The first slide I will show you here is just our Boone County Hospital website and how you can go online and self-enroll. Right here, once you log into our Boone County Hospital website, there will be a health portal launch, and then you will come up in here to click here to log in if you're a registered or self-sign up. So for first-time users, you want to go to self-sign up, and we must have your email on file at either the hospital or the clinics, and also the last 4 digits of your social security number. If you get an error when you go to the self-enrollment page and it is not successful, that means a couple of things. We either do not have your email on file or your social security number. So we have to have everything matching in our computer system to be able to enroll you. So this is our self-enrollment create an account page. We will need your last name and first name. Remember, this is your legal name. So if you go by something different, whatever is in our computer system will be what you need to register. Then your date of birth, your gender, you can have your medical record number, which we can provide you as well, or your last 4 of your social security number, email, and then confirm your email. And once you have that and all is good, then you should get a success page that says you have completed enrollment, and then you will get an email. Once you get the email, you will launch into that email and you will come into our Boone County Hospital page. You'll set up your password and get on into the patient portal. So here is our sign-in page. You can place any announcements on here. So if we were going to have a system upgrade or it's going to be down for service maintenance, we can put that on here so our patients are aware that it is down, or any sort of announcement that we'd like to put on there when patients log into our portal. Once you are inside the portal, you have lots of launch options. We have messages, we have our health record, medications, appointments, billing, and then your person profile. I'll go into a little bit of all of these in the slideshow, and then I will also show you kind of live in the portal, show you around there a little bit more. But you can get any announcements. So as you can see, this is our test system, but you can see any announcements. So if we have a new physician coming, or flu shots are available, or anything like that, we can place announcements in the main page of the patient portal. Then you will see any activity that's been done within the last 30 days. If you have your COVID-19, we have uploaded those certificates so patients are able to get those off of their patient portal, and then a shortcut to pay your bill as well. The next page I was going to talk about is proxy access. So this is if you are the patient and you're needing proxy access to your children's medical records. We have proxy forms, which I will go over here in a little bit as well. And then once you get those submitted to Boone County Hospital or the clinics, we add them to your patient portal. Once that is added, then you have access to change your person, and you can change any of the patients that you need within there. So proxy kind of works two ways. You can have children on your own patient portal, or if you are not a patient here, but you would like siblings or a parent or anything, we can create you a patient portal and add the patients within your patient portal. So you can still have access to anyone else's medical records that you would need. But obviously the proxy has to be filled out by the patient that is letting you have access to their records. Then here we're going to talk about sending messages to your provider. So you have 24 hours a day that you can send a message to your provider regarding something that you think about later in the day or a follow-up for your visit, anything like that. You will send and receive these from your provider, and you will be able to access those at any time. And we'll go through sending a message. So you can view any sent messages that you can see your date and time, and within that, and then you will also be able to send the message. So once you send the message, you are in here with a little bit of announcement. You will then select the provider within here, and then your subject and your message to the provider. Once you hit send, that goes directly to the provider and to the nurse, and they will be able to communicate back and forth with you. And you can kind of see these red dots, and that's kind of an indication that something is in your record under that area. So we have now launched into your health summary, health record, where you can see your allergies, medications, any current conditions, immunizations, any information on this main page that'll get you there. So then we go into the medications tab, and you can also see your medications in there. You can print them. You can see any information. Once you launch into those medications, you can get more information. Then you can request an appointment. So you can't technically schedule the appointment, but you can request it. And this again is kind of like the patient message to your provider. But you go over here to the right-hand side and you can schedule an appointment. As you can see here in the bold, that this test patient has a future appointment. So also to show you that you can see any of your future appointments that are available. So then once you schedule your appointment, once you get launched into there, then you will be asked to pick the type of appointment you want: office visit, physical, well child exam. If you're unsure, it's okay. You can just select something, and then your location, and then it will ask you the provider. And this just kind of makes sure that it goes to the correct provider's office to request this appointment. Then once we have the appointments, we are now onto the billing tab. So you can see all of your billing information with our Boone County Hospital contact information to the business office. Here you can see any accounts that are current, or you can also see your outstanding accounts and past accounts. So you can see once you launch into those, and we'll show you when we go into the live portal, but you can see more information when your insurance paid, how much you're owed, and information like that. Then you can also update your profile. Within here, you can update your demographics for yourself or any emergency contact information. So what this is basically, if you've changed your phone number and you think about it late at night and you want to jump in and update your profile, you can jump in, update your profile, send it off, and then the next time that the staff is in your account or scheduling you an appointment, they get an alert that there has been an update to your profile in the patient portal, and they're able to update that right into the system. So a little bit about the portal on the go is, like I said, We have access to an app that we have on your mobile device. You can simply download the mHealth app from Apple or Google Play, and I gave a little picture of the app icon that you would find. And once you're in there, you select one time Boone County Hospital, and then once you're in there and log in, then that's just a one-time thing to select Boone County Hospital. You can manage your information 24 hours a day, 7 days a week, and you can check it at all times on your own device. And then lastly, I have technical support. We have a couple of ways you can reach us. So you can email support at portalhelp@bchmail.org, or you can phone support at 515-433-8730, and that is a direct line to Patient Portal. We have support hours Monday through Friday, 8 to 4. Please provide a detailed message, whether you're calling regarding yourself or what kind of issues you're having for technical support so we can better assist you. Leave a voicemail. We'll get back to you as soon as possible. And like I said, the more information helps us help resolve issues with your portal. So since we are through there, I'm going to go ahead and in this slideshow and share with you the patient portal. So here is our sign-in page, and I'm going to go ahead and, wow, that's So I have launched into my patient portal. So as we said, as I explained, there are our announcements. These are all hyperlinks that you can get into. So I have new documentation, so kind of a shortcut, as long as able to also see them up here above. So we have the messages tab. We have the health record. So I was going to go more into detail regarding our health record, as we have lots of patients regarding lab results or x-rays, all sorts of information that can come in throughout the patient portal. Once you launch into there, you come to your health summary page, your allergies, your medications, anything like that. On the right-hand side are the shortcuts where you can get to these items. So results are going to launch you into your lab results. So once you're into your lab results, you will see any lab results, the date they were done, the results, any communication. These are available to the patient immediately following the results of the labs or x-ray, anything like that. If you are looking to see, like, if you've had this done multiple times, you can click on the lab that you're looking for, and you can review all of your past history of your labs. And you can kind of see any ranges or how that was working. You can print these. You can then just back out here and back out to your health record. So results is going to be your labs. Your visit history is going to be any past visits that you had within Boone County Hospital or our clinics. So again, you can see them in date and time, where you were seen, what clinic you were seen at, and then you were able to launch into that and be able to get, once the provider is done with the documentation, you will be able to see documentation, the patient or the provider's information into regards of that visit. Medications, right here, and as you can see, I had a red dot, which meant I was given a new medication since I had been on the patient portal, so it bolds that for you. So within there, if you click on the medication, you can get some information regarding when it was last updated, if you needed information about it. And always, if you see this little hyperlink, you can always contact technical support through there, and it'll launch you and give you information to reach out to us. Allergies and conditions, we kind of talked about that, but we can see that on the main page. Then you are on reports. So reports are going to be the document that the provider has signed and your information from that visit. Then you'll see what kind of progress note it was and anything within here that was given at that visit. And it is that particular visit. You'll be able to go back far to find any information as well. Then in the documents, we have letters. So if your provider has provided you with a letter, you can always get those as well and be able to print those. If you're not around a fax machine where they could send it and you have the patient portal, once it is uploaded into the system from the provider, it is available to the patient. Then you will have any reports, so you can see them as well through here, any results, any visits. It's kind of another shortcut to others. As you know, when you check in, you have verbal consents that you sign and consent to treats. So you can always look back and view those as well, as those are uploaded here as well. So that is kind of our patient portal that I wanted to show you about on the health record. So then you can look at your immunizations as well. If you're needing to get something for your child to go to camp or school, you can always jump in here as well if you're able to do that, or you can reach out to your provider's office. So let's go back to the home page here. So we kind of talked about the health record. Medications, again, is just another shortcut to launch you into the medications tab where we were. There's multiple places to get different ways, which is nice. You can see a future appointment. You can launch into this and kind of give some information, what time, how long, the reason for visit. You can cancel that. If that option is available to cancel, you can send a cancel to the office. Here is the billing tab that we have here. You will be able to see, since I am the owner of this patient portal, I'll be able to see any patient that I am the guarantor for. So my children or spouse, anything like that, I will be able to see that. I will be able to launch into here, and you can then see any information and charges that were for that visit. And then if you go to the show all accounts, you can see anything previously that you want to look up. If you felt, you thought you paid this bill, or you have any questions or want to dig a little deeper in there, you can go in there and it will let you know if it's pending or billed, any information. Obviously, if any questions, reach out to our business office or send in a tech support, and we can definitely get you to the right place to assist you with those. And here's your profile that I was stating. You could update if you needed to update just a little bit of information, demographics, or contacts. And you can update your profile and then send that to your medical record to be updated. Up here in the change person, I'll talk about the proxy. So I have access to these 3 test patients that I can have access to if I need to get in and see a result. So I would just launch into that patient and I am now into their medical record access. It always will default to the patient who has the ownership of the patient portal. And then you can always just change that back or log off from there. We have a few people in-house. Is there any questions?
I have a question, actually, and maybe I missed it. I apologize for that. But when you are signing the proxy, are you doing that in person or are you doing that online?
Yeah, definitely. Great question. And I was going to share that. So thank you. So we will reach out to our Boone County Hospital website right here. And I'm going to launch into our homepage. So once you're to our homepage, you can go to the health portal and there will be all sorts of information here for you. So here is your click here to log in if you want your login from here, our self sign up. And then just kind of a little thing here, we talk about our app that we have. And then down here, we have access to these proxy forms that you're able to print off yourself. And you can email them to the technical support at the help desk, or you can return them to the patient registration at Boone County Hospital or any of the clinics, and they will get them to the IT department to take care of it. So anyone under the age of 11 don't need to sign for themselves, but anyone once the age of 12, they kind of get kicked off and they have to re-sign up. So if a patient has reached the age of 12 and the parent is seen, they no longer see their medical records, that is because they've reached the age of where we need a new signature now that they are 12 for you to obtain access of their records. And then it happens again at the age of 18, but we do have proxy forms for adults and any information on the proxy.
Do you mind clicking on one and just see what it looks like?
Yep.
So then if I had a printer, I could print that, fill it out, or...
Yep. Or you could print it, fill it out, you can mail it in, return it to the clinic or hospital, or email it directly to our support system. So here you just would be the parent who is the legal guardian, and then who is the patient that you're asking for access for. And then in this one, we just need the signature of the parent because this is a minor. On the adult one, it is a little different as you're going to put the patient information first. So the patient information is who you're wanting to have proxy access to. And then the proxy information is actually the owner of the patient portal. And then if you have one already, or if you don't, like I said, we can create patients or users patient portal without being a patient if they're getting proxy access for adults or children around here.
So when they would turn 18, for example, they just automatically on their birthday get bumped off of the system and you'd have to do the next proxy form. And
Yep. So the age of 12 and then 18, or it might even be close to 19, but yep, then they get their own. So they have an option that they can be their own proxy, or if they're still okay with the parent having proxy access, then they can be on their parents as well. Multiple email addresses can be used. So if you have more than one patient in the same household, you can all have the same email address on file because you're all going to use your own username and password. And you are the only one attached in our system to that particular patient portal. The only thing is when you get emails, you will just have to pay attention to who the email goes to, what patient shows that. But when you get an email, it'll say, Dear Kelly, you have a new result in your patient portal. And then you'll be able to launch right in from that email as well and log in and be able to get right to that, the report that is pending. So you'll get an email notification once anything new has hit your patient portal, whether it's a result, a medication, a document, an appointment, any information, a message, you will receive an email. However, if you've been on your patient portal within the last few hours when that result comes in, you may not see the email because you were kind of already on there when that was coming through. So just kind of be aware to, if you don't see something, to just double check. You may have missed that.
That was one of my other questions too, which is right there in the screen too, which is I think helpful for people just to be reassured of the safety and security of it. And this is not anything new. I think every hospital system is going to this type of portal where people can access their information, which I think is really helpful. But I'm sure there's some people that are hesitant just from a security standpoint. So just reminding people or reassuring them of the encryption and the things that are in place for that security side of things.
Yes. Yep. Very secure. And each user, like I said, has their own username and password. And obviously when you sign up, you kind of saw the features that you had to know to be able to sign up that matches our medical record system. Then down here, kind of again, just to repeat, but you can find that on our page, the email address to email us, and then the direct number to our patient portal line. That is all I have to share with you today, but feel free to reach out if you have any questions or need assistance logging into the patient portal or even just getting set up. And hopefully we answered all of your questions today, and I appreciate you having us.
Yeah, thank you so much.
Did you have a question? Yeah. I noticed on my portal that I don't see anything under the billing portion. Is that because I don't have a bill or once it's paid off, isn't it?
Nope, you'll be able to, you can still see it. It's in the outstanding, let's see, did I log off? Probably logged off, didn't I? Yeah, you can still see outstanding.
The history?
Yep.
Okay.
So let me share that. So right here, there is a show all accounts right there. And if you launch into that hyperlink, it'll show you all outstanding accounts. So as long as you're the guarantor, then you should be able to see those.
And I suppose it takes time too. Like if you go in for a visit, it has to go through insurance and
Absolutely.
kind of
Yeah,
all
it's not going to show up right away. Yeah, once it's, I suppose I'm not sure the timing on it exactly, but once it's been posted and coded and all that kind of stuff before it gets on there, pending out to insurance.
Thank you, Kelly. It seems really straightforward. And like you said, you've shared the phone number and the email address of where people can contact you if need be with more specific questions. But otherwise, I think that concludes our program for today. Thank you so much.
Thank you.
Thank you.